there are two types of stem cells in our bodies. The stem cell is actually the building block of your bodies. They have the ability to become all of the different types of cells. There's 50 or 204 different types of cells in your body. The stem cell is the one cell that can become any one of the other 203. It's the master cell. It is what allows our bodies to go from 8 pounds to 128 pounds in a matter of 10, 15 years. They build our bodies. Their job is very complicated, but it's also very simple. They build your body, and then as we get older, their job is to repair the body.
Hey, what's up, everybody? Welcome to a brand new episode of the None of Your Business podcast. Sean and Lacey here with you again this week. And we have a super special guest with us.
Guests.
Well, I was just thinking as it's a group. The Regen
Okay.
is the guest. But there are two of them that make up the Regen group. We're going to talk about something that is on the tip of the tongue of so many people. I'm super excited to learn more about this. Everybody wants to know about stem cell therapy. What is it? How does it work? Mm-hmm. Is it legal? Is it ethical?
And is it right for me?
Well, for the healthcare providers that watch the show, yes, maybe this is something that you might want to incorporate into your business. But for everybody else, something you may want to get and apply into your own health. I have so many friends that are turning to stem cell therapy for all kinds of different things that they tell me that it's helping them with, and it's kind of incredible to hear these stories. And so we figured we would get some very special guests from the Regen group.
The group. It's a group, so it has to be more
there they
than
are.
one.
There's the group of them. We've got Adam and Sara with us. Welcome to the None of Your Business podcast.
Thank you for having us.
Thank you very much for having us.
So we always begin with this same question here on the podcast. We'll begin with you guys with the same thing because I think it's going to be interesting. Tell us a little bit of your story. How do you guys end up getting into this whole deal of stem cell therapy?
That's a great question. Kind of like I always, everybody asks me, how did I get into this? And one thing led to another. It was all relational based. I met someone who said, hey, I think you would be good really helping educate people about regenerative therapy. So I started 5 years ago, really doing educational seminars with a company. As the more we progressed and the more I learned, the more I decided, you know what, there's some things I would want to do differently. So I went into business with a partner at the time, back in right after COVID. So 2021, 22, right in that time frame, we went out on our own and started our own company, picked up another partner, and then ran our own business really for about a year and a half. And then realized that one of the things that we were doing, we were just doing cold. We'd go into a town, we'd do a dinner seminar, we'd educate people. One of the things I always was looking for was, how do I build a relationship in a community? And how do I align myself with people that are like-minded who want to actually serve the patient? And so that's what really started Regen Group. And my partner at the time then got introduced, obviously, into Black Diamond, and we started to really start to play with this idea of how we can introduce it on a larger scale and really affect other people's lives. And then September of last year, like anything else, we made the decision to buy out our partners. And so Sara, who'd been doing all the behind scenes with us, kind of took a bigger role in the company and now is partners, and kind of got drug along, but is doing well, I think. And it's been enjoyable working. Obviously, you guys know, with your spouse, there's challenges that go along with it, but ultimately, I think for both of us, and I think you'll agree with this, the fact that we are changing people's lives and serving people's health is number one, what keeps us up, getting up in the morning, making sure we're doing things correctly, and trying to grow this the best we can. That motivates both us and all of our staff, because it is a very powerful therapy that can change people's lives. And I truly do believe in it. I've done it myself. Sarah's done it. It's a very cool process to go through.
I'm curious, what were you guys actually doing before this whole journey started? Like, where,
Oh,
yeah, I'm curious as what you were spending your time on, what career you were in. Yeah.
so I did a lot. I've always been in sales, marketing
Hmm.
and sales. I've done work for all different kinds. I had an insurance company for a while. She actually did that with me. That was our first foray working together. We learned a lot in that we changed since working together. Um, that's my background. I've worked with lots of different companies, but really nothing to this extent where we're doing healthcare and really changing people's lives like this. This is a really cool industry. My background, I'm actually a religion major with a communications and biology minor. So how I got here, don't ask me how. I have no idea. So
Yeah.
I always laugh. I always make jokes. I'm a religion major, and I ended up doing stem cells.
Right.
That just blows my mind. Your background?
So I actually majored in biology with the intention to go to vet school and then became a mom. And I was a stay-at-home mom for maybe 10 to 13 years, somewhere in there. And then I picked up part-time jobs, actually mucking stalls at horse stables because it's something that I thoroughly enjoy. um, my most recent job prior to the business was working at the local high school, which I liked because it gave me the opportunity to have the same days off as my kids, work the same kind of basic schedule that the kids were in. And I really just enjoy that because I want to be able to be there for the kids and go to their stuff and participate in their lives. So that was an important factor for me, which also is a reason why having our own business now is important because it,
Yeah.
like tomorrow, we're moving my daughter home from college. And if I had a regular job, I wouldn't be able to just pick up and go and do what I want.
Absolutely. Absolutely.
Well, let's start chipping away at some of the potential myths or misconceptions that might exist out there about stem cells. Let's begin with, though, what is stem cells? What even are stem cells? Um, where do you get them? What's the
Yep.
whole deal of stem cells?
So a stem cell, there are two types of stem cells in our bodies. The stem cell is actually the building block of your bodies. They have the ability to become all of the different types of cells. There's 50 or 204 different types of cells in your body. The stem cell is the one cell that can become any one of the other 203. It's the master cell. It is what allows our bodies to go from 8 pounds to 128 pounds in a matter of 10, 15 years. They build our bodies. Their job is very complicated, but it's also very simple. They build your body, and then as we get older, their job is to repair the body. So as you are injured, as you are just wear and tear, it's the stem cells in your body that help to do the repair. And what happens as we age is we lose those stem cells. So what regenerative therapy is, or stem cell therapy is supplementing your body's own supply. Now, there's a couple ways you can do it. There's really, in order to do stem cell therapy, you have to have a large volume of stem cells. And really, in order to get those large volumes, in the past, we've really drawn from three different types of stem cell. The first, which is the most probably famous of all the stem cells, is the fetal embryonic stem cell. In the US, those are the ones back in the 90s under George Bush that became illegal. And so, because we were told they were coming from aborted fetuses, so all stem cells became illegal because of the fetal embryonic. Today in the US, the fetal embryonic stem cell is still illegal. And so that in the US, we have two other options as far as where we're getting the stem cell. The first is out of your own body. It's called an adult stem cell. And in essence, what they do is they harvest your own stem cells. So they take stem cells either out of your fat or your bone marrow and then put them in the area that is needing the supplementation of new cells. The second kind of cells, and this is what we do, is an umbilical cord tissue. So we take the cells out of an umbilical cord that's been donated after a live, healthy birth, and then we supplement the body supply with these cells. The beauty of what we offer patients is there's a ton of stem cells, but there's also cytokines and growth factors and structural proteins and all this other material that is vital to your body's ability to repair itself. And so we supplement the body with an enormous amount of cells that divide very quickly, like brand new cells do. Every 24 hours they're dividing, and so it supplements the body supply. And our bodies are designed to repair themselves. It doesn't matter whether you're 6 years old or you're 96 years old, you're designed to repair yourself. And so what happens is we get it stuck in these places. Either inflammation takes over or we're damaged and our body can't keep up. So supplementing the supply is a phenomenal way to restore the tissue, the connective tissue, the cartilage, the tendons, ligaments, even nerves can be repaired through regenerative therapy. But it enables the body to do what it's intended to do, which is repair itself.
I was just thinking about the two different ways that you could get stem cells. And number one, I imagine that if you're getting it from your fat or your bone marrow, that is not a fun process. But you also said earlier that over the course of time, as we age, we don't produce as many stem cells. So is it like, what kind of person should be thinking about, should I get my own stem cells because maybe that's more impactful or effective or more, it's easier for me to do, or should I be going to something like this?
So I tell everybody that one of the biggest issues in our industry is the immaturity of our industry. Each type has its uses. Adult stem cells are right now are firmly implanting themselves when you're dealing with different types of cancer treatments, things like that, where you don't have the ability to have to worry about risk with you're taking your own cells and putting them back in your body. A lot of the cancer treatments are coming from adult stem cells. As we age, though, the number or how fast they divide slows down. So it's always beneficial to put brand new cells in your body because they're going to divide the quickest. And so I always tell people, if you're in your 20s or 30s, your adult stem cells can still be very effective to treat conditions. When you start getting into your 40s, your 50s, your 60s, they've slowed down dramatically. To give you an idea, a newborn stem cell will divide about every 24 hours. A 35-year-old stem cell will divide about every 48 hours. And then at age 65, it's about every 60 hours. So you do the math on that. It is dramatic how much we lose as we age. Adult stem cells can be very effective. I would never tell anybody not to do adult stem cells if that's what they feel is best, because it can be beneficial. I just am a huge believer in the umbilical cord because it has the new cell. It's a vibrant cell. It's dividing every 24 hours. It's giving your body the most ability to do the repair that is needed.
We have slow dividing cells, babe. Just so you know.
That's what Adam says.
I know.
Never been
We're in that
tested.
higher range
I
up there.
might have fast dividing cells.
Huh?
Look at my belly. My belly cells are dividing fast
Or multiplying.
and multiplying. All right. Well, let's talk about what kind of things. You mentioned a lot of things: connective tissue and
Right.
cartilage and even nerves. So, what are the most common things that people might be suffering with that causes them to search out stem cell therapy?
So generally speaking, the number one issue that we see people coming for is pain. So they have knee pain, shoulder pain, hip pain. Some of them are advanced enough that they're maybe to the point of being on the edge of needing a replacement, and they don't want to do that. They're looking for an alternative to that surgery. And so pain is number one top reason that we see patients. And it, in our experience, has been ridiculously effective for pain and inflammation. Then we do see some like autoimmune conditions or more chronic type of conditions. And those are definitely a case by case basis, because we just want to be careful that you're not, like Adam always says, throwing a cup on a 5 alarm fire. Like
Mm-hmm.
if the situation is very advanced and they have a lot of stuff going on, then it's gonna take a lot to get them to where they probably want to be. And so we typically are a little more careful with those, but there's a lot of simple things like, uh, my dad actually wrecked his shoulder. I don't even know, but he had I think a labrum tear, and he couldn't put a plate from the kitchen counter into the upper cabinet. And he had his shoulder injected, and in about 90 days, somewhere between 90 and 120 days, his physical therapist said, I can't get you any more range of motion, like you're at the max for
Nice.
healing. And he was able to like throw a pallet into the bed of his truck like it was nothing. So things like that are pretty effective, pretty simple, pretty straightforward. It's where we get into some of those more chronic and autoimmune conditions that it's a little more in depth.
Mm-hmm.
The other
Well,
thing we're
explain.
starting to
Oh,
go ahead.
go ahead,
Sorry.
Adam.
The only thing, the big one that we're starting to see an increase in is the biohacking now.
Yes.
Mm-hmm.
We're starting to see preventative side of things. That can be a little bit more challenging in that we have to like temper people's expectations, because a lot what biohacking is someone in their 30s who says, I don't want to get to, or my 40s, and I don't want to get to where my knee bone on bone and knee. So they're trying to get ahead of the ball game. And so a lot of times patients will do that and they'll go, wow, I haven't really noticed anything. And it's interesting to me that even though they don't notice anything, they're putting billions of new cells in the body. So they may not notice anything right now, but 10 years from now, 15 years from now, when they normally would have been bone on bone, they're functioning correctly because we've loaded the body. It's no different than a vitamin or a supplement that we take. Same process. We're trying to stay ahead of it, and that's the same process. And we're seeing a large number of people now trying to do things preventative.
Mm-hmm.
So explain to us what does the therapy look like? You mentioned an injection, and that sounds scary.
Right.
So what does it look like to receive this therapy? Is it just one injection, or I have to get a lot of injections? Is it a big needle?
No, it's actually a pretty small needle most of the time, 22 gauge, if anybody is familiar with needle gauges. It's the same type of needle that you would get with like a flu shot or something very similar to that. So it's not, this long and made for horses or anything. Um, and as far as the injection itself, typically, so like for a shoulder, for example, they'll figure out where the bulk of the pain resides. So if someone comes in and says my shoulder hurts, the nurse will talk with them and figure out, does it hurt more in the back or more in the front, more on the top, whatever. And then they'll basically do an intramuscular injection into that area. So they'll go into the muscle in the shoulder, and concentrate the cells in that area, and then the cells will work. They will spread out somewhat and work around that joint. For a knee, they go into the capsule around the knee and do the injection. For a hip, it's kind of similar to the shoulder. They mostly go into your glutes or into the front of your hip, depending on where the bulk of the pain is. And then we also do injections along the back. So those typically go into the paraspinal muscles in and around the area of pain. So if it's a lumbar pain, they're going to put the injections down in that part of the back. If it's cervical, it's going to go up in the cervical area. And then oftentimes with back issues, we also recommend an IV injection to go along with those intramuscular injections in the back. So they'll just do a single IV typically. Sometimes it can be more. If the patient wants to load their body a little bit more, we can definitely always do that as well. But it's not an IV bag and a drip. It's just a push straight into the vein of the cells.
And so, just to clarify for everybody listening, there isn't any like recovery period because it's just an intramuscular injection, right? But how
Right.
long? I know
Correct.
you said your dad was about 90 days before he had full range of motion. Do most people experience immediate results? Does it take a little while? Like, how do they feel afterwards?
So it varies from patient to patient, and
Hmm.
it's funny because people will say, "I've had this for 20 years. How long is it going to take me?" And my answer to them is the same as if someone hurt themselves yesterday. I can't answer that. What we have typically is 4 to 6 weeks is our average time where people will get a noticeable change, where they go,
Right.
"Okay, I noticed something here." Now it's funny because we're seeing the more severe cases we get, we're for lack of a better word, we're overdosing the patient because we really want to make sure that the patients are seeing good results. And so they're responding very quickly. We have patients who routinely will say, "It's been a week and I cannot believe how great it's been." We just had a patient in California. Absolutely, like when I did the consult with him, I was like, this poor guy. It was like watching someone 10 minutes get out of the chair. I mean, he had to have both arm rests and it was painful. And he went back into the chiro's office, the doctor's office, and said, "Hey, look at this." And he literally just stood right up out of the chair. And the the chiropractor said, "I cannot believe I've been treating you for 10 years and I've never seen you get out of a chair that fast." He goes, "The pain was like that." So it can happen very quickly for patients. On average, 4 to 6 weeks is really a good timetable to see noticeable. And then obviously, if we have fast ones, we do have some that go longer. And so we just have to monitor that with each patient.
And
So
as far
let's. Oh, go ahead,
sorry.
Sarah.
Well, because she asked about recovery too, there isn't really any kind of a recovery period necessarily, but we do tell patients to take it easy for a couple of days because we
Mm,
don't want you to be like, hey, my knee feels better. I'm going to go hike Kilimanjaro. And
right.
then they hurt something or they overstress themselves and create a new issue basically.
Right.
So we do recommend just take it easy. Don't go overboard because we have had that happen where
Yeah.
patients feel so good that they go out and then they hurt themselves because their body's not used to it yet.
Yep.
Of course. Let's talk a little bit, two sides of this coin. Um, your company is Regen Group. Um, if you are a potential beneficiary, if you're like, I'd like to explore stem cells, how can people find out where they might be able to access you guys to receive stem cells themselves? Two, of course, there's a lot of healthcare providers that watch this program as well. So if you're a healthcare provider and you're like, hey, this sounds like an interesting offering, are there opportunities for them to be able to partner with you to bring your services into their business?
Yeah, absolutely. So the we've tried to make this as simple for either person, the person who wants it or the health practitioner. It's go to our website. Our website is www.regen-group.com. And there is a click a question and answer, click a consult button. It's a calendar um, invite, and you just pick a date, and we'll sit down and talk with you about whether it's about you getting treatment. We can walk you through what it looks like, all that kind of stuff, all the different variables that go into that, having it done for yourself. Or if you're a healthcare provider and you're looking at this, how do I bring it into my clinic? We can sit down and talk with you on that. It's the easiest way. Our calendars are up to date all the time, and we're available all the time on there. There's our numbers are on there as well, but the Calendly event is the best way to book a call.
And for like a practitioner that is interested in doing this, I mean, a lot of people are like, wow, this probably something that could really benefit, my patients. They've asked me about this before, but a lot of people get nervous because they think I'm going to have to do so much work. So what would you say for somebody that's like, I like this, but I feel like I can't bring something else in?
So that's really why we started Regen Group, was to help those practitioners. Doing this for 5 years, I built relationships with medical staff to be able to do the actual procedures, with the tissue bank that we use, with malpractice, with all of the ins and outs of this industry. There are a lot, and there are a lot of regulations with the FDA on how to operate in this space. And so that's what teaming with us does. You get all of that expertise with teaming with us, and then we work together to help you bring it in, including everything from the marketing side of things, how you market, what you're allowed to do, to the actual delivery to the patients. That's really what we specialize in for our patients, or with our both for our patients, but also from the healthcare providers that we work with.
I think one of the biggest questions, and you mentioned this, from the tissue that we get, maybe a question and a concern that anybody would have, whether you are a beneficiary, a client, patient, or if you're a provider, is that. I mean, I don't want, I don't know what's being administered to me, and there's sometimes a degree of controversy, as you talked about in previous administrations, about these cells. Talk to us about the cells that you guys are getting. How do you get them? Are they good cells? How do we know that they're good? And
Right.
how do the providers know that they're good?
So we use a tissue bank. We use only one tissue bank. It's Biogenics. They're out of Houston, Texas. And really, we've chosen them for several reasons. They've been in the industry for a long time. One of the things I've seen over the 5 years is tissue banks come and go. Biogenics has been here the whole time. They've got a product that is phenomenal. One of the reasons I love them is they are the only tissue bank in the country that has a contract with our government to do, they provide tissue for the VA system when they do studies. And why I love that is because it's funny because they tell us all the time that that contract is a blessing and a curse. The blessing side is they're the only ones that have it. So they have some instant credibility because of that. But he said the curse is the fact that in order to have that contract, they're held to a very high standard on what this material has to meet, what criteria it has to meet. Everything from its efficacy rate to the amount of cells that are in the material. Um, and that's one of the reasons I love Biogenics is they have the best product on the market in that their vials, they tell you exactly, not exactly, but they tell you a vial has approximately 30 million stem cells in it. Most other tissue banks will give you this has 1 milliliter or 2 milliliters of material, and you don't know the number of cells. And so the cells are an important part of what we're putting in the body. And then they're hot. They have to be registered, obviously, with the FDA. They're inspected. Biogenics is really the gold standard when it comes to the tissue bank because of that contract with the VA. They really have done a phenomenal job with the product. And I know that's one of the biggest questions people will ask me is when I talk to a patient, well, how do I know what I'm getting? There's literally, in essence, for lack of a better word, a certificate of authenticity that says this is what you're getting, this is how many cells are in it, these are the tests that have been performed, this is how they performed, the batch, everything is on this, and it comes with every one of the vials that a patient will get when they get shipped out. It's funny because people will say, well, how do I know I'm not just getting water or saline? And the reality is the FDA regulates our industry higher than almost any standard that any other industry because there have been so many tissue banks that have done things incorrectly. And so now they're held to such a high standard. They're inspected all the time. And it's become a very highly regulated industry. So the FDA regulates everything we do, from the tissue bank, plus the marketing side, plus the administration, how
Yeah.
we administer that to patients.
I love that. I mean, I think, you being in the industry for this long, can give people confidence, that they're going to get like, again, like you said, quality cells, but also quality service, which I think is super important.
Yeah.
Anything else to add? How can people get a hold of you? Let's re-give them the website because there's
Website.
a dash in there.
I know.
It's www.regenerative, Regen, REGEN -group, GROUP.com.
Perfect.
Whether you're a prospective client or a provider who would like more information, you can go to the website regen-group.com. Sign
Yep.
up for a call, and you can talk to Sarah or Adam and find out more about what they're offering. You can find a provider in your location,
Near
depending
you.
on where you are. And if you're a provider, you can be added to the list of people that are providing the service. Could be a phenomenal opportunity for you to add a new service to the people that you're currently caring for. I think this is a great thing. I have one last question. You talked about biohacking, and fortunately, I don't have any pain in my joints. I don't have any pain right now anywhere. So but I'm interested in stem cells. So I was wondering, like, in the biohacking side of things, where did they inject it? Do you just take an IV, or do you just put it in your butt? Like, what happens?
Yeah, no,
I'm
it's
gonna
an
go
IV.
with no on the second one.
The
No,
glute.
that's one
The glute.
not
The
where.
glute. She
Yeah,
said it was She said it was a intramuscular
She did.
injection.
Yeah.
In the
If that was
glute.
taken out of context, it could have not been good.
It's not a Bailey show.
Gosh.
Jeez.
Yeah, it's a simple IV. I mean, we're going to do a push right in the bloodstream. We're going to do typically body mass index does play a factor in how much we put in the body, but typically it's 3 vials, so you're going to get 90 million stem cells. And the beauty of what it does is it really, when you're biohacking, what we're trying to do is a couple things. We're trying to, first of all and foremost, strengthen your immune system. Your body's ability to repair itself is 100% contingent on your immune system. Um, as chiropractors, or healthcare providers, your immune system is key to your health. And so we want to keep that immune system functioning properly. And this large dose, the first thing it's going to do is going to boost the immune system so that it works efficiently. And then I always use the analogy, then we're going to provide your body with millions and millions of ambulances to do repair that your body will then assign jobs throughout wherever they're needed, and you are able to really stay ahead of that curve, because as we start to get older, like I said, you lose those cells, especially a joint that gets all kinds of wear and tear. The body can feed that area new cells if they need it to do in those areas.
So one thing Adam didn't really say, because it's a technicality, but on average, one cell from a newborn, so the umbilical cord, becomes about 1 billion cells at the end of 30
Wow.
days.
Yeah.
That's amazing.
And so if you're getting 90 million into your vein, then you're going to have a lot of stem cells in your body at the end of a month.
Yeah.
That's
I need
incredible.
stem cells.
You need stem cells?
Well, I'm old, so my stem cells are just slow. They're sluggish.
They're
So
sluggish.
They need help.
one of the biggest things about the IV, and this will appeal to most women, is we hear it all the time when they do it, their skin dramatically changes. It literally glows is the word I hear all the time. The pliability in your skin. We're starting to see a lot more cosmetic uses for
Yeah.
stem cells,
Mhm.
and so like it's called the V facelift. They'll
The
do
facelift,
shots in the
yep.
face, all that kind of stuff. Incredible results with skins. We had a patient who had age spots all over his arm, and he had an IV, and within a week they were gone.
Wow.
Wow. Okay.
Well, that's
Very,
some
very
pretty incredible stuff there.
Yeah.
I want to encourage everybody once again, Regen-Group.
Group.
Regen-group.com. Find out more about stem cell therapy. We are just in this podcast just scratching the surface of what
What's
it is
possible.
and what it can do for you. This is your invitation to reach out to Adam and Sara and learn more. Adam and Sara, thank you so much for sharing your knowledge, everything that you've learned about this amazing new therapy with all of the viewers and listeners of the None of Your Business podcast. We appreciate you guys being here.
Thank you
for
guys
having
very
us.
much. We appreciate you guys.
All right, folks. Well, I hope that you will reach out to Adam and Sara. This could be something that changes your life. It could also change and impact the life of someone you love. A lot of us have older parents that maybe are dealing with things, and maybe you're like, hey, maybe this is for them. So I hope, again, regen-group.com. I hope that you will reach out, check them out, see what stem cell therapy can do for you. Fascinating episode today. I think that
We
so
love
many
this
people
stuff.
are going to comment about this episode because it's just, it's the new stuff, and a lot of people don't know about it. And there's a lot of misinformation out there, not like the fake kind of like political misinformation, but real misinformation
Yeah.
that people just don't know what they're talking about. So you've got to be careful because, when you're injecting your body with things, you got to make sure that you are in the hands of somebody that, one, truly knows what they're doing, and two, truly has your best interest at heart. And Adam and Sara fit the bill on both of those things. All right, everybody, we'll be back again next week with a brand new episode of the None of Your Business podcast. Thank you so much for tuning in.